Our maintenance fluids are running behind it, and honestly, switching compression. I need a board under this baby, please.
Alyssa was 8 days old, and about that time, we were at the pediatrician's office. The nurse came in, and they were checking all the vitals, and she said, she just made a comment, I need to get a new thermometer, this one is broken. Nobody thought anything of it. Next thing you know, Alyssa completely became mottled, started having a rough time breathing, and at that point everything kind of happened really, really fast. As it turns out, their thermometer wasn't broken. Alyssa's body temperature was indeed 92, so she was obviously in heart failure and her body was shutting down.
What happens is the valve that flows, that allows flow to happen for those first couple days, closes. When it closed, we lost flow to her body, so she started passing away.
Alyssa was born with a very rare form of heart disease called double inlet left ventricle. And essentially what happened was that she only has one functioning pumping chamber or ventricle that can pump blood both in her initially to the body and to her lungs.
And they said, well, your baby has a very complex heart defect. And even still at that point, you're like, I don't know what you're talking about. This can't be true.
When the first doctor came in, it was Dr. Frank, and he just came in and said, we don't really know yet, but this is what we think, and it's this, this, or this, and this is what we would do, most likely this.
We got through that, and they were really good here, and they kept coming in and explaining and asking us, do you have questions? Do you have questions? And, trying to figure this all out. And I remember my first thing was, well, can you fix this? And they said, yeah, well, we can fix it. It's going to take 3 surgeries by the time she's 2. And we're like, okay, good.
She underwent her first 3 planned cardiac surgeries, which involved cooling her body to a very cold temperature, stopping her heart, stopping all life support so they could do the operation, repairing her heart, reconstructing the blood vessel that goes to her body, and then rewarming her up and bringing her back into the intensive care unit, obviously, for recovery after that heart surgery. On the first postoperative night, Alyssa unfortunately had a cardiac arrest. And in order to resuscitate her from that cardiac arrest, she actually ended up back on something called ECMO, which is essentially a heart-lung machine that we can run for several days or several weeks, whatever is necessary.
It's 3 or 4 in the morning. I'm sitting in the hallway, and Dr. Berger comes in. He was at home sleeping. It was his day off. And when he heard this had happened, he got up, showered, got all dressed, and came down, sat down and talked to me. And I thought right then, wow, this is pretty important. If he woke up, drove all the way down, and the first thing he did was come sit across from me and ask me to join a study.
I met the Foxes after Alyssa had her cardiac arrest, and I was when I was approaching them for the THAPCA study.
As far as I know research is important and I know studies are important, but at that point I really didn't care.
Approaching a parent at that time after their child's had a cardiac arrest is a very difficult time for the parents. Clearly parents are under a lot of emotional strain. They don't understand what's happening with their child. Often the cardiac arrest is a sudden event, and the child looked reasonably well prior to the event, and so it's quite a shock. I
know from a science background that's important. We don't learn anything without studies, but it's going to be, it's not good timing. When they're asking these things, it's the most uncomfortable moment.
Does my child have something that's so strange, they need to be in a study? What is going on here? This is my kid, and we're here, and you're supposed to take care of her and not study her like she's some foreign object.
Here we are now. We have this, I want to say duty, or opportunity, but it's kind of both of those things. And if I don't do it and the next person doesn't do it, it's never going to happen. So, here we are. Let's do our part.
So the THAPCA trial is actually 2 studies looking at therapeutic hypothermia, or cooling the body after children have a cardiac arrest. And the purpose of this study is to determine what's the best temperature to keep a child after cardiac arrest, whether it's better to be at a normal temperature or a colder temperature. So when I approach a family like that, I try to make sure that, first of all, they've had all of their medical questions answered, that we've met some of their emotional needs, maybe let them see the child, even if the team is still resuscitating the child, just so that they can know that their child is there and have a connection with their child. Once we do that, that's when we begin to discuss the THAPCA trials. And it's very important to me to talk to the family and let them know up front that they don't have to do this, that it's voluntary, that I try to address, I know it's a hard time for you, I know I verbalize it's an emotional time, and we discuss begin to discuss the study.
A lot of these doctors and actually researchers have enjoyed watching Alyssa grow and flourish, especially since they were here from the day we came in, which, you know, we have a happy ending, especially from where she came from, and they really like to see that.
You grow kind of a bond with them. I just saw one of the doctors out in the hallway, and he was a fellow at the time, and you know, he just said, "Oh yeah, that was my first cardiac arrest." I said, "Oh, that's funny. It was mine too."
Families who allow their children to participate are being very generous to allow their children to maybe have additional testing done, to have additional procedures done, so that we can understand how the treatments work and how to make them work better.
If there hadn't been people, I say pioneers, or people who've offered their kids up to do experimental surgeries in the beginning, then yeah, her life would not be possible.
It's important to do research in children for a couple of reasons. First, they have different illnesses, and although they may have heart disease, their heart disease is far different than adults with heart disease. And similar can be said about children with cancer. Their cancers are much different than adult cancers. So in order to treat children optimally, you have to do specific trials in children to address differences like in types of cancer, types of heart disease.
Doing clinical studies in patients is important in order to determine what are the best ways to treat patients for specific diseases. And so, you know, many of us have actually participated as adults, perhaps, in research trials where they're evaluating one kind of drug versus another kind of drug. Children are often ignored from this process or not considered for studies because of perceived risks that they shouldn't undertake. People look at their children and they want to protect their children, and so understanding whether it's appropriate for them to be in a trial, which is essentially an experiment, is really the crux of society's reluctance to do that.